Hi, my name is Osvaldo Mendez, and this is a critique of incidence of multisystem inflammatory syndrome in children, also known as MISC, among U.S. persons infected with SARS-CoV-2. The objective of the study was to estimate population-based MISC incidence per million person months and to estimate MISC incidence per million SARS-CoV-2 infections in persons younger than 21 years of age. MISC is the name of the severe illness seen in young patients after COVID. The clinical features include fever lasting days and severe inflammatory process involving two or more organ systems. The primary exposure was previous or current COVID-19 infection. This was measured with RT-PCR serological tests or exposure to suspected or confirmed COVID-19 case within 4 weeks prior to symptom onset. This was accurately measured using the CDC's case reports, which were defined as a clinically severe illness necessitating hospitalizations with fever, elevation of inflammatory markers, involvement of two or more organ systems, and no alternative plausible disease. This was done via a cohort study that used prospective and retrospective data from participating hospitals to identify persons with MISC between April 1st and June 30th of 2020 in 7 states. The sample size was 248 and only participants younger than 21 years of age were used. There was likely some bias in the selection of the study subjects, given that the last month of data collection, the participants were required to have positive COVID testing, whereas the ones prior to that month were not. This likely introduced some selection bias, given that testing was not widely available for part of the data collection period. There is also likely bias in the collection of information due to misclassification bias, given that MISC has no one test used for diagnosis, but is rather based on presence of exposure or test results in certain clinical features. Some of the provisions that were made to minimize the influence and confounding factors prior to the data analysis were matching and deduplicating of case reports. Here's the table with some of the distribution of persons with MISC. The 7 states where the hospitals that participated are listed. The researchers obtained 95% confidence intervals using univariate Poisson regression with offsets from population estimates or numbers of SARS-CoV-2 infections. Estimated stratum-specific adjusted MISC incidence using multivariate Poisson regression with jurisdiction, age group, sex, and race ethnicity were included in the model, and this helped to control confounding during the data analysis. The measures of association that were reported in the study were adjusted incidence rate ratios that were used to compare the differences between the groups. The statistical stability reported in the study with a 95% confidence intervals not overlapping and 1.0 being considered statistically significant. The major results of the study were that between the months of April and June of 2020, 248 persons under the age of 21 reported to have MISC at locations described previously. 53.4% of them were male, 39% of them were Hispanic or Latino, 30% of them were African American, and the median age of onset was 8 years of age. Overall, the incidence of MIS-C during the study period was 5.1 persons per million person months, and the overall incidence of MIS-C was 316 persons per 1 million SARS-CoV-2 infections. The interpretation was likely affected by the information bias because of the incomplete or nonspecific responses to race and ethnicity. This was discussed as a limitation in the need for imputation based on jurisdiction data. That required 49% of the COVID cases and resulted in skewed data toward white and non-Hispanic groups, since jurisdictions overall tended to be more heavily described as such. The discussion section did adequately address the limitations of the study, including the inclusion criteria being changed during the last month, and how testing capacity during the first 2 months made this inclusion criteria almost impossible to follow. They also discussed poor external generalizability, a major limitation of the study due to the fact that only 7 jurisdictions were part of the study. The main conclusions were that MIS-C is a rare complication of COVID. They also concluded that it will be important to compare these results to incidence of MIS-C once vaccinations and other therapies are more widely available. They did note that the incidence of MIS-C was higher among younger children and children of Hispanic or Latino background, Black and Asian or Pacific Islander backgrounds. They cited the importance of further studies to study risk factors. The study is poorly generalizable given the significant events that have occurred since the time period in which this study took place. Now, with vaccines, biologics, and improved therapeutics, combined with the presence of new variants, make this study unlikely to be generalized to any larger population. Also, given that the study was only conducted in 7 states at the time, that also makes it harder to say it can be generalized to a larger population.